last 2 decades. Want to bring in board-certified physician Dr. Leigh Vinocur. Doctor, thank you for being here. This headline is a bit concerning to anyone who's dealt with the reality of cancer and has had that impact. This new report from the CDC expecting that global cancer cases are going to rise. You know, in 2024, there were nearly 21 million new cases. Most common was breast cancer, lung cancer, prostate, colorectal cancers. Experts say that the increase is in part caused by a growing wealth disparity. Can you explain that for us?
Well, a couple things. Some of the good news is that cancer increases as we age. So we are having more aging populations. But there are disparities because there are lifestyle changes that we can make to help prevent cancer, certain cancers. But you also have to have screening exams to catch it early. We are catching it earlier in some places, but those are in nations that are richer nations. People that have better insurance that can catch it early and get the treatment. So there are those disparities, socioeconomic disparities, but the key is lifestyle changing. Lung cancer, quit smoking. We know colon cancer can be related to obesity, so healthy diets and things.
So is part of what you're saying here that part of the elevation in numbers is just the detection, especially the ability to detect more cases in wealthier nations?
Some of it is the detection. Some of it is that the aging population, as you age, you have a higher risk of getting cancer. So it means people are living longer. Yeah. There is also some good news that deaths are going down, at least in wealthier nations, where there's a whole host of new treatments that looks at the genetics of the cancer, and we have immunotherapy. So there are better treatments too, but there is that disparity, as you mentioned.
Yeah, and as we were showing there a moment ago on that map, this is something that is affecting not only here in the U.S., but globally. If we zone into the U.S., though, for a moment, we saw nearly 2 million cases in 2023. That's 455 cases for every 100,000 people. That has gone down slightly since 2014. Are we making as much progress as health experts expected? As you pointed out a moment ago, we do know life expectancy, that has increased once diagnosed. But how do we prevent this altogether? That's the question most people want to answer.
Well, the American Cancer Society has said in the past that almost a third of cancers are probably related to lifestyle and preventive. So the key is healthy diet, exercise, get those screening exams. But as people start to lose insurance in this country, too, that can create a problem. And some of the research that was cut to actually find new treatments, that's an important thing to think about, too. And there is no just cancer, right? There's a ton. They're all different diseases. So they require research, specialized drugs, and those are things that we have to think about.
You mentioned a few moments ago some of the risk factors here, right? Tobacco use, alcohol, unhealthy body weight. These are all major risk factors for cancer. But chronic infections and air pollution, that's also something that we're hearing is putting people at risk. And those are harder to avoid without proper care. How does someone fight against cancer? How does that change, again, with wealth disparity? And how is that preventing people from critical healthcare access?
Well, it is important that we provide healthcare access to our most vulnerable, and we provide healthy foods, fruits and vegetables to vulnerable populations. We haven't been able to talk about disparities in the last couple of years, and we've taken away some of the research from that and also some of the funding. So it's important that everybody, does the most that they can do personally, and then maybe even talk to their representatives and make sure, is that critical funding for cancer still going to be there? Are we going to help at-risk populations get healthy fruits and vegetables and get those screening exams like mammograms and colonoscopies and things like that, and make sure there's coverage for that?
Yeah, right now is the time to talk to those elected officials who will be electing again, come November. Let me pivot to this. I want to ask you about this parasitic illness, cycloporiasis, I think that's how you pronounce it, hitting parts of the country. Hundreds of cases are now being reported, and it's a rarely life-threatening illness, but it's really unpleasant, to say the least, for some people. The symptoms like diarrhea lasting for long periods of time, cramping, nausea. People tend to get it through contaminated fruits and vegetables. What's your word to people who are concerned about this and how they can stay safe?
Well, certainly, and it's cyclosporiasis, and cyclospora is the bacteria. The parasite. And certainly there's this risk of contaminated fresh fruits and vegetables, although we just talked, it's very important to eat fresh fruits and vegetables long term, but washing them as much as you can. Perhaps people talk about cooking vegetables. You're right. It is not like a fatal case, but it's very uncomfortable, described as explosive diarrhea, which is not something
doesn't sound good.
Right. And it can last sometimes for a month, but also you can have some GI upset. Any foodborne illness that affects your GI tract can cause upset. But the one good thing about this, a very common antibiotic, Bactrim, is effective against it, even though it is a parasite and not a bacteria. So if you're having these symptoms, definitely go to the doctor. They can check for parasites in your stool, and there is treatment for it.
Yeah, that makes me feel a little bit more comfortable. I found myself at a restaurant recently wanting to order broccoli, and then a little concerned on whether they wash the broccoli properly, so I skipped that order. I'll have those fresh veggies at home where I can control a little bit more of the cleaning. Doctor, really appreciate your time and your insight. Dr. Leigh Vinocur, thank you so much.
Thanks for having me.